Okay, we're recording. Fantastic.
Great.
So, happy after Christmas. Happy almost New Year to everybody watching. Thank you so much for joining us. And Peggy, talking with Peggy today. And I want to thank Peggy from the bottom of my heart for agreeing to share her story with anybody who is going to be watching this and listening to what she has to say. So, Peggy, I'm going to let you start and just give everybody a little bit of background of where you were. Now, obviously, we had a relationship
Yeah.
before I almost had my little mini meltdown and decided I was going to quit practicing medicine altogether, which I'm sure every doctor has gone through at least once in their lifetime in their practice. And then, so I took a little retirement from practicing for about a year or two and then came back. So I just wanted people to know that we had a physician-patient relationship before, and then recently reestablished our relationship. So anyway, go ahead.
Changed my life.
Oh,
Changed my life. So where I was about, it's probably been 3 years, symptoms, a lot of gut intestinal issues. My stomach was constantly upset, and I constantly maybe overused. It was upset a lot of weight gain. When I saw you before, I have been a caregiver for many years of my family, my family of origin. And when I saw you 5 years ago, I was talking about how I take care of everybody in the world, and you said you need to stop taking care of everybody in the world because sooner or later it's going to catch up to you, and who's going to take care of you? So I didn't listen, because that's kind of my role in my life with my family. And 2 years ago is really when things started taking a downward spiral. I ended up having an emergency appendectomy because we thought that was, well, because my appendix said take me out. But that did not stop the problem. I've gone through many tests before I reconnected with you, Dr. Edwards, and we thought it was my gallbladder. We thought it was all kinds of issues. Nothing. I ended up in the emergency room 2 years ago in Austin, Texas, with stomach symptoms. They thought I was having a heart attack, and I, of course, wasn't. It was a messy gastrointestinal issue. After that, my issues continued. That is when another swallow test was done to see what was going on. An endoscopy was done. The doctors, they couldn't find anything. So I just continued on, and our mom was 90 at the time, and I continued taking care of her long distance, just going to see her in Texas. And then this past February, my mom passed away at the age of 91. And I look like her. My face looks like her. I did not want my body to look like her, and I love her dearly and miss her dearly. But I just kept thinking, Peg, you've got to do something. I was miserable. I can't tell you how many times I was out in public and fearful that I was not going to make it home or make it to a bathroom. And even started wearing those fancy little Depends that are so pretty.
love that name too.
Yeah, no kidding. Depends. Or Prevail. Prevail is
even better.
But anyway, nothing was changing. And one of the telling things that happened to me was in June, when I'm at the beach now, don't be haters. And we have a condo in the Outer Banks, and our youngest son, daughter-in-law, and 2.5-year-old granddaughter joined us. And my son at one point asked my husband, do you think mom's okay enough, well enough to take care of Artis, our granddaughter, while the four of them, my sister was here too, went on an all-day fishing excursion? That really, really hit home with me. I thought, oh my gosh, what are other people in my family perceiving that I can't see? Mm-hmm. And was it grief over my mother? Yes. Was it not feeling well? Absolutely. It was a combination of everything. Mm-hmm. So I knew I had to do something. And then 2 months passed, and my cousin and his husband came and visited, and his husband had lost 15 pounds. And I was like, dang, you look good. And of course, he was using another program, but I thought, I've got to do something. My hormones are out of whack. Been postmenopausal since 2000 after a hysterectomy, complete hysterectomy. And anyway, I thought I need to reach out. I've got to find someone. And I, looked for you, and I'd contacted somebody in the Lexington, Kentucky area, and wasn't really pleased with what was happening. There was just something in my gut and a whisper in my ear that said, see if Dr. Edwards is available. Mm-hmm. And we connected, mm-hmm. and I started a program with you, and I've lost 14 pounds. Not that the pounds are the thing. It's the way I feel. Mm-hmm. And I get emotional talking about it because I felt so bad for so long. And I'm just saying to all of you women out there, don't give up. Don't give up. Even when you feel like you're down at the bottom, you can crawl up, and you just reach your hand up, and this beautiful lady can help you, and this is not an ad for Dr. Edwards. It is just me saying that I was pretty well down at the bottom, and I will tell you this, after my mom died, I had a brother who died 3 years ago. Then my mom died 2 years ago. My doctor in Lexington, doubled my Celexa. So, and my, people say, well, you're going to be on that the rest of your life. And I'm thinking, no, I'm not.
Yeah.
And the time will come for that to happen where I start taking care of that issue. But right now it was much more than depression. And I'm not waking up a sweaty mess anymore. I feel like I'm regulated more, and my gut is so much better. I can.
So how long, you said you felt bad for 2 years, you saw all these doctors, they did all these tests on you, they gave you, actually you were on more than just Celexa, you were on several other things that
yes.
You're not on anymore. And how long did that take?
To feel better?
Mm-hmm.
To get off of some of those things, and to feel better, I would say I started this in September, mm-hmm. and I would say within a few weeks, I started feeling better easily. Mm-hmm. Easily. I would say after 10 days, mm-hmm. I started feeling better.
Yep.
And then weaning off one of the medications, oh my gosh. That medication was doing me more harm, which you had said,
right.
than good.
But in the conventional medical world, that's what we're trained to do. Symptom yes. equals drug. And especially if they're doing all these tests on you and nobody can figure out what's wrong with you. And right. all we have to offer is a drug. And the other thing I think that I wanted to go back to, you had mentioned that you'd seen another practitioner in the Lexington area. And I've talked to women all over the country and heard similar stories that you had gone in there and they had tried to modify your hormone dosing, and mm-hmm. that didn't go very well. And, mm-hmm. Again, one of the reasons I like to bring women like you to speak about this is to let people know that you have to be really, really careful when you're picking somebody to work with, especially when it comes to hormones, because you can really mess women especially, men as well, but you can mess people up a lot if mm-hmm. you don't know what you're doing when it comes to the hormone piece of it, because that is so critical and affects everything else. So I just wanted to point that out, that you'd also had that similar experience.
Yes. And thank you. And so true. So true. It's amazing to me how once my hormones have become regulated, so many symptoms, I'm not tired like I was. I'm not wanting to take a nap, which I rarely do anyway, because I'm a high energy person. Mm-hmm. But for example, at one point, my husband said to me that I had lost my joy. And I'm usually a joyful person, but hello, my mom died. Yeah, I lost my joy. Mm-hmm. But there was so much more to it than that. And I asked a girlfriend in Lexington, I said, she said, you normally run at a 10 or maybe even higher than a 10, when a 10 is the highest you can get. Mm-hmm. She said, I would say you're probably running at a 3. Mm-hmm. And I thought, well, something's got to change. And of course, that was all before August. You
Right.
know, the end of August when I connected with you, I cannot tell you joy and getting an email response and saying, "Oh my gosh, there is a light at the tunnel, and it's this beautiful doctor." So,
You're funny.
yeah, but you're right. The doctor, yeah, some of the doctors are okay. So you're depressed. Let's give you this. You know, no blood tests are done. Um, you know, all the other tests that were done were for my gut, and so here I
Right.
am.
So, one of the things I really try to enforce in the group and when I do these interviews and when I talk to patients is, I'm obviously one person. I can't take care of everybody on the planet, but I try to give people the tools they need to at least find somebody, what to look for in a person. And sometimes it's really difficult. But I keep begging women to just be so careful about who you see, whether it's integrative medicine or conventional medicine, or it doesn't really matter. But you only get one of these. And,
Mhm.
you don't want just anybody messing with that, because if things go wrong, it's really, really, really hard to reverse whatever they do wrong. And I've seen thousands of those things happen. So, in conclusion, what I'd like to do is to let you if you had one piece of advice to give to everybody watching this, what would that piece of advice be?
Listen to your body. Listen to your body and the messages that it's sending you, and then find a doctor who will truly, truly listen to you. And it may take more than a handful of doctors, but listen to a doctor, or go find a doctor who will listen to you and say, "Listen, this is what I'm feeling. I'm not kidding. I'm not imagining it. But my main piece of advice is listen to your body and don't give up.
Mm-hmm.
Don't give up."
Well, you're perfect proof that if you don't give up, look where you get. And,
Mhm.
since the average life expectancy of a woman is now about 89,
I like that.
you have a lot of time left. I mean, we're going to feel really good, and everybody's going to have a hard time keeping up with you now.
Right. That's my plan.
Well, thank you so much for speaking with us and sharing your story. And obviously, we're going to be best buddies for a while. I don't, now that you're better, we'll touch base, once or twice a year. But that's the goal, really, is to make people better so that they don't become chronic care patients. And that's not what anybody wants, really. So
Right. Right.
thank you again so much. And I really appreciate it. Love to you too.
Okay.
Bye-bye.
Bye.